Audit Scotland has today published a scathing report into the Scottish Government's £1.26 billion NHS recovery plan. The plan is described by the auditors as, quote, a high-level, top-down document that does not contain the detailed actions that would allow overall progress to be accurately measured. And this matters. This is the plan of the now undisputed frontrunner to become the next First Minister of Scotland, Health Minister Humza Yousaf, who's been criticised this winter for urging the public to, quote, think twice before calling 999. But this morning's new independent auditor's report takes criticism to a whole new level. Here's a little flavour of what's inside. Quote, the NHS in Scotland faces significant growing financial pressures. Quote, a growing capital maintenance backlog. Quote, more people are being added to waiting lists than are being removed from them, and people are waiting longer for treatment. And delays in getting social care support for patients who are ready to leave hospital continue to limit the availability of beds. Now, the auditor criticises Humza Yousaf's department's GP recruitment numbers as, quote, misleading, warning that the Scottish Government is now failing its ambition to recruit an extra 800 GPs. Indeed, it notes Public Health Scotland's report that far from expanding, GP working time equivalent actually decreased. It decreased by over 26% between 2017 and 2022. That's the wrong direction. And a key element of the Yousaf recovery plan was the National Treatment Centre programme, new purpose-built centres for planned and diagnostic care. But the auditors today have said that delays to the National Treatment Centre programme mean targets for increased activity are unlikely to be met. 3 centres that were due to open last year in NHS Fife, NHS Forth Valley and NHS Highland, they've all been delayed. And the auditors now say that some national treatment centres are unlikely to open until late 2027 or 2028. So that's treatment centre delays, GP target failings and growing waiting lists, all in a plan that fails to deliver measurable details. And that's according to Audit Scotland. Now, the Auditor-General, Stephen Boyle, says that ministers have to prioritise which NHS aims can realistically be delivered, and they need to be more transparent about the progress they're making. It's not a good look for the First Minister frontrunner.